Hello Clever Chronicle family, welcome back to the channel. If you are new here, I'm Vision, and in today's video we'll be talking about something that might sound like it belongs to a horror movie, which is Haemolacria, or simply bloody tear. It's a rare condition that causes blood to mix with tears, and it can be both alarming and mysterious. So if you ever wondered what happens when you cry blood, keep watching. Imagine looking in the mirror and seeing blood streaming from your eyes instead of tears. Sounds like a horror movie, right? But it's a real medical condition called Haemolacria. So what exactly is Haemolacria? Haemolacria is a rare condition in which a person has blood in their tears. It can look dramatic, but the causes range from harmless to serious. It also causes some vicious lacrimation or tears. Now let's take a close look at the two types. We have the true Haemolacria and the false Haemolacria. True Haemolacria refers to the condition where blood is actually present in the tear film as it's secreted from the lacrimal system. That means that blood originates within the structures responsible for tear production and drainage. We have the causes of true Haemolacria. 1. It can be caused by infection and inflammation of lacrimal gland or sac. It can be caused 2 by trauma. It can be caused 3 by tumor or growth of lacrimal gland or nasolacrimal duct. 4. We have hormonal influence like vicarious menstruation, that is, bleeding that occurs in organ than the uterus during menstrual period. 5. We have vascular abnormalities. The fragile or dilated blood vessel near the tear producing area can leak into the tears. 6. We have idiopathic, meaning no identifiable cause despite thorough evaluation. So let's move into false Haemolacria. This occurs when the source of blood is not from the lacrimal system itself, but contaminates the tears externally or internally as they pass over the eye. In other words, the tears themselves are not bloody from the start, but get mixed with blood from another source. What are the common sources of false Haemolacria? We have 1. Bleeding from nearby structure. 2. Conjunctiva or eyelid lesions. 3. Cosmetic or artificial substance. 4. Malingering. What are the diagnosis and investigation? The diagnosis often include eye examination like slit lamp imaging and blood tests to rule out infection, tumor or bleeding disorder. Treatment. This depends on the underlying cause. It can range from artificial tears to surgery or medication for tumor or bleeding issues. Cases examples. A case of 11-year-old girl who presented with bloody tears. She stated that the bouts were spontaneous, occurring 2 times per day, lasting for 2 to 3 minutes, and not associated with any stress or cry. She was of premenarcheal age and do not have any menstrual history and no history of systemic illness, medicine intake, and trauma in the past. First aid for Haemolacria. If you ever find yourself or someone else experiencing Haemolacria, the first thing to do is 1. Stay calm and reassure the person or yourself that you are addressing it calmly. Panic can increase blood pressure and worsen the bleeding. 2. Wash your hands thoroughly before touching the eye or surrounding area. 3. Gently clean the eye area with clean water or sterile saline solution. Do not use harsh solution or eye drop unless advised by doctor. 4. Avoid rubbing or pressing the eye. 5. Observe for associated symptoms. 6. Apply cold compress. If trauma is suspected, this can reduce swelling or slow capillary bleeding. 7. Do not self-medicate. 8. Seek medical attention. Haemolacria may seem threatening, but with proper diagnosis, it can often be treated or managed. If you or someone you know experiences bloody tears, it is important to see an eye doctor immediately. Do you find this fascinating? Hit like, subscribe, and comment if you ever heard of Haemolacria before.